So, hi there! Thank you for checking out my channel. Dear students, it's me, Teacher Jam. Thank you for clicking up this video. Don't forget to like and subscribe. This video is part of my lesson in grade 10, MAPE in Health. I made this video to help other students as well as parents in their MAPE subject. So, are you ready? Let's start. Purchasing or availing health services and products. This time, you will be able to learn about health service providers and how to check and report fraudulent health services. The activities designed in this module will help you become familiar with the topics or lessons about healthcare providers and on how to report fraudulent health services. Working in the module is a stress-free experience. You know why? Because you can do the task or activities at your most convenient time and place. Welcome to Grade 10, Health, Quarter 1, Module 2, Healthcare Providers and Fraudulent Services. In the previous module, you have gained information Number 7. He specializes in the children healthcare and treatment of diseases. Number 8. He specializes in correcting deformities of the musculoskeletal system by means of surgery. And number 9. It is an institution where people undergo medical diagnosis, care, and treatment. And lastly, we have he specializes in diseases and abnormalities of the gastrourinary tract. Don't worry of your score because the result of your activity will not be graded. It's just my way of checking your prior knowledge about our lesson. So later on, I will going to check it into our Google Classroom. Your answer in our Google Classroom. So, are you done? Great. And now, look at the pictures. Are you familiar with them? So what's the answer in the first picture? It is obstetrician. And also we have our pulmonologist in our second picture, and lastly we have pediatrician. So very good. As you can see, we have different kinds of healthcare provider who has a specialization on their chosen path. So this time, our focus and the discussion is all about health professionals, specialists, and fraudulent health services. You are sick? Who you gonna call? They are our healthcare providers. So, as a wise health consumer, you should know the different health services provided by these professionals. Some of these services are as follows. Number 1, we have feeding program for elementary school children. Number 2, immunization for different diseases and intended for infants and children from ages 2 and above. Number 3, prenatal checkup for mothers and babies. Number 4, free maternity clinic. Number 5, family planning program. So these are the different health services provided by health professionals. First, we have health services. When we talk about health services, it is usually offered by healthcare providers. A healthcare provider is a trained professional who provides people with healthcare. When we talk about our healthcare professionals, they are trained, complete their doctor's degree in a physical field. After completing to specialize in a field of medicine, for example, if you finish studying being a licensed ophthalmologist, it is a treatment of eye diseases and disorders. So you can treat eye diseases. And then we have health professionals. These are individuals who are trained and licensed to practice medicine along with allied health programs and work in the medical profession. So as you can see, we have here the doctor, the nurse, the nutritionist, and also physician. These are the different types of physician based on their area of specialization. So they are trained and licensed in their specified specialization. We have also pediatrician. So what is pediatrician? It specializes in children's healthcare and treatment of diseases. So etymology, it is in the Greek word pies, which in children, iatros, which means healer. So what are the significant diseases of pediatric? Significant diseases? Vaccination, diagnose and treat your child's illnesses. We have also the infection, injuries, and other health problems. And also they are focusing in one's growth and development of our child. Have psychiatrist. So what is psychiatrist? So when we talk about psychiatrist, it specializes in the diagnosis and treatment of mental disorders. So they have psychological problems. So their significant diseases are panic attack, frightening in hallucinations, thoughts of suicide, or hearing voices, feeling of sadness, helplessness, anxiousness. So psychiatrists are qualified to assess both mental and physical aspects of our psychological problems. So people seek psychiatric help for many reasons. So they seek medical attention for many reasons. So next we have obstetrician. In obstetrician, specializes in the care of women during pregnancy and childbirth. So if you have problem in pregnancy or childbirth, obstetrician is the right for you. What can OB/GYN treat? Condition and treatment. General gynecology, pregnancy, menstruation, menopause, pelvic floor issues, contraception, gynecologic cancers, and screening tests. And also the surgical procedures in terms of female reproductive system, referring to pregnancy, and also contraception. Next, we have ophthalmologist. Specializes in diagnosis and treatment of our eye diseases and disorders. So, ophthalmologists are allowed to use medication. A partial list of the most common diseases treated by ophthalmologists include cataract, glaucoma, macular degeneration, diabetic retinopathy, dry eyes, strabismus, and also we have bisaligment deviation of eyes, proptosis, bugged eye, excessive tearing or tear duct obstruction, and eye tumor. So if you have suffering from such a diseases in your eye, so ophthalmologist is the right person to go. Next. Next, we have dermatologist. In dermatologist, specializes in the diagnosis and treatment of skin diseases. So they treat some skin diseases. Next, we have in our cardiologist specializes in the diagnosis and treatment of the heart and blood vessels. So they are focusing in our heart. What are some significant diseases? We have congenital heart disease, coronary heart disease, high blood pressure, or hypertension. Next, we have allergies. So when we talk about our allergies, specializes in diagnosing and treating body reactions resulting from unusual sensitivity to food, medicine, and dust and other substances. So, what causing allergy? They often treat patients who have had a food allergy or drug allergy in some food or medicines. So, it is the adverse reactions of their body, a disorder of the immune system causing adverse reactions to substance, especially for those who have asthma. So allergies occur when your immune system reacts to a foreign substance. So allergies occur when immune system reacts to a foreign substance. So an allergy starts when your immune system mistakes a normally harmless substance for a dangerous invader. So there's a dangerous invaders enter our body. The immune system then produces antibodies that remain on the alert for the particular allergen. When you're exposed to the allergen again, these antibodies can release a number of immune system chemicals such as histamine and that cause allergy symptoms. So we have anesthesiologists specializes in administering various anesthetics to assure proper operative procedure. So it is undergo with the patients before or during and after surgery. So some of those we have a general anesthesia. It is a combination that put you in a sleep like before a surgery or other medical procedure undergo. Next we have pulmonologist. So when we talk about pulmonologist, it specializes in the diseases of the lungs and respiratory tract, which is our lungs. So the significant diseases are asthma, emphysema, lung cancer, tuberculosis, and pneumonia. We have also the neurologist specializes in providing diagnosis and surgical treatment of diseases of the nervous system, focuses in our brain. So a doctor who specializes in the brain, spinal cord, and nerves is a neurologist. So neurologist treats patients with significant diseases like stroke, epilepsy, headaches, migraine, brain tumors, sleep disorders, Parkinson's disease, and Alzheimer's disease, and so on. Next, we have gastroenterologist. When I talk about gastroenterologist, it specializes in the diagnosis and treatment of diseases in the gastrointestinal system. So as you can see, we have here this intestine. What are the causes of normal contractions of muscles in the intestinal walls or also develop after gastrointestinal infection? Stress, anxiety, and also we have peristalsis, overeating, too much fat in diet, eating too quickly, smoking, and so on. Next, we have geriatrician. So last time we discussed about children, pediatrician. Now we have geriatrician. What is geriatrician mean? So geriatrician specializes in care of elderly and the diseases that affect them. So we have pediatrician, and then next we have geriatrician. What are the significant diseases? Dementia, arthritis, pediatric care, osteoporosis, osteoarthritis, rheumatoid arthritis, Parkinson's disease, arteriosclerosis, heart disease, high blood pressure, and also we have high cholesterol. So we have surgeon. Specializes in performing surgical operations and treating diseases, injuries, and deformities. So as you can see, there is a significant diseases like removing tumor, cancer cells. Next, we have urologists. When talk about urologists, specializes in diseases and abnormalities of the gastrourinary tract. What are the significant diseases? We have also the kidney diseases, such as kidney stones, cancers, uh, testicles, and also we have treatment of the prostate gland. Next, we have gynecologist. So, when talk about gynecologist, specializes in the diseases and care of the female reproductive organs. What are the significant diseases? Cancer of the reproductive organs, including ovaries, fallopian tubes, uterus, cervix, vagina, and vulva. So, referring to the woman's or female reproductive system. Next, we have also healthcare facilities. So, what are healthcare facilities? These are places or institutions that offer healthcare services. There are different types of healthcare facilities. So what are the different kinds of healthcare facilities? So let's find out. These are the following types of healthcare facilities. First, we have hospital. It is an institution where people undergo medical diagnosis, care, and treatment. In the Philippines, there are two classifications of hospital, general and a specialty. So in general, hospitals have complete medical, surgical, and maternal care facilities. On the other hand, specialty hospitals handle a particular disease or condition or deal with only one type of patient. So we have two types of hospital classification. We have a general and a specialty. When it comes to general, it is a complete, and specialty, it is a condition with deal with only one type of patient. Next, we have walk-in surgery center. When talk about walk-in surgery center, it is a facility that offers surgery without the patient admitted in the hospital. So they are walk-in surgery center. Next, we have health center. It is a facility that caters a specific population with various health needs. So when talk about health center, varies with private, public, and barangay health centers, many in rural municipalities. Most of the national burden of healthcare is taken up by the private health providers. So it is mostly seen in our barangay health center. Next, we have extended healthcare facility. When we talk about extended healthcare facility, it is a facility that provides treatment, nursing care, and residential services to patients, often the elderly. Next, we have, and lastly, we have health insurance. So, what is health insurance? So, can you give me one example of health insurance? It is PhilHealth and Sun Life. So, what are those? It is a financial agreement between an insurance company and in an individual or group for the payment of healthcare costs. So, some of those examples are PhilHealth, and also we have the private healthcare plans. And now, let's summarize. We have health services and health professionals. Next, we have pediatrician, psychiatrist, obstetrician. So there are different types of physician on their area of specialization. Next, we have ophthalmologist, dermatologist, and we have pulmonologist. Neurologist, gastroenterologist. We have also this time we have pediatrician, and next we have geriatrician. Okay. Next we have surgeon, neurologist, and also we have gynecologist. So these are the following types of healthcare facilities. So we have healthcare facilities. So number one, we have hospitals, walk-in surgery center, healthcare center, and extended healthcare facility. And lastly, we have, what are those? They are health insurance. And now, assessment, direction. Inside the box are the different types of medical practitioners. Match the type of medical expertise with object requiring medical attention. So inside the box are cardiologist, neurologist, pulmonologist, dermatologist, orthopedist, urologist, gastroenterologist, ophthalmologist, geriatrician, pediatrician, and also we have gynecologist. So we have here the item 1 to 10. So you need to match the type of medical expertise with object requiring medical attention. It is also posted in our Google Classroom. Next picture, we have 3, 4, 5 up to 10. Thank you for watching. If you like, enjoy, and learn the video, please click like and share button. If you want to see more videos, kindly hit the notification bell and subscribe button. And if you have something to say, please leave a comment. Thank you. See you on my next video.